Good morning, everybody. Are we all ready? Yeah? Okay. Okay. Good morning, everybody. Welcome to the Safeguarding Education Overview and Scrutiny Committee. It's Thursday the 11th of September and it is almost 10:05. Should we start with apologies?
Thank you, Chair. So we've had apologies this morning from Steve Bell, from the Reverend Michael Metcalf, from Helen Arnold and Victoria Wilson.
Thank you. Do we have any declarations of interest?
Yes, I do. My brother works at the prison, Warrington Prison.
Okay, so we'll move on to minutes of the meeting held on the 24th of July 2025. Is everybody happy for me to sign those off as true and accurate?
Yes.
Thank you. To item 4, Staffordshire Safeguarding Children Partnership Annual Report. Could I ask the members to just give a little introduction of yourselves before you begin?
Families, and I'm one of the 3 designated safeguarding partners for the multi-agency safeguarding arrangements.
Morning everybody, Victoria Lee, Detective Chief Superintendent working for Staffordshire Police, Head of our Public Protection Team and also Chair of Staffordshire Children's Safeguarding Partnership.
Morning everyone, I'm Stephanie Nightingale, I'm Designated Nurse for Safeguarding Children for the ICB. I'm representing Heather Johnston, our Chief Nursing and Therapies Officer. Thank you.
Thank you very much. Thank you for coming and presenting this report to us. If you could, I don't know who's going to go first, Bernie.
Rather than jumping between the 3 of us, I'm going to just summarise why we're here, the purpose of the annual report, and then I've got a summary slide deck just to assist members in understanding the overarching context, and then we can take questions in relation to the annual report, clarification, any observations that people want to make in respect of the annual report. So this report is to assist you as political leaders to understand how the Safeguarding Partnership operates, how we work together across the partnership to keep children in Staffordshire safe. Expectations of our work in relation to the partnership are laid out in the statutory guidance Working Together to Safeguard Children 2023, and they have been developed to underpin effective multi-agency practice, and we include wider strategic leaders and middle managers, but it's very clear that the 3 key partners are the local authority, Staffordshire Police and the ICB. We present this report on behalf of the wider partnership, but in our roles as those key statutory partnerships. So, you know, from your perspective, it's really important that you understand the detail of the operating model of the Safeguarding Partnership, and some of the key partners, Councillor Screen, Councillor Lakin, we're at, and I think if my memory serves me right, Councillor Large, but I'll stand corrected, we're at an event that the partnership facilitated. They were able to see and meet a wider range of key partners, and those events happen during the course of the year. It's really important to note that this report is not covering the here and now, so that these reports look back on the previous year. Okay, so I will, if I can. There we go. Okay, so I think I've just done slide 1. So the report summarises our refreshed vision, the mission and values, and the new multi-agency safeguarding arrangements have been published for Staffordshire. So there have been some changes in the last 12 months to national guidance and the national approach of safeguarding partnerships. And we have included a child-friendly version because, as you'll probably be aware, particularly those of you that are new members, we have lots of phrases that we use by default, lots of acronyms, and sometimes that can be confusing. And so the child-friendly version is to try and really drill down and have an understanding of the impact of our safeguarding duties on children and families that we work with. We've refreshed the structure of the partnership to support arrangements, and we've created the new Safeguarding Children Partnership Advisory Group, and key counsellors are involved in that Safeguarding Partnership Advisory Group. We have a new partnership chair, and my colleague Vicky has been the chair for this year. There is normally an expectation that is a revolving chair between the 3 key partners, and Vicky took that role on for the first 12 months. We've strengthened the involvement of education, and we've got a wider representative groups of head teachers. It's hard to get complete representation when we're operating in Staffordshire because we've got over 400 schools, but we now have a system representative from early years, primary and middle schools. I always have to remember that we have middle schools here, secondary and special schools. We've together agreed the priorities and areas of focus for the next 3 years. And you can see that in the documents. We have a development plan for improving the effectiveness of our arrangements, and we have refreshed our performance and quality assurance framework, and that is implemented through our Scrutiny and Quality Assurance Plan, which is not this scrutiny, this is our Safeguarding Partnership scrutiny.
Out of this new programme that you set up, the Friendly, how much of it is actually have you used co-production?
Well, I'm coming on to that in the slide. So if I can finish the slides and we can take questions at the end, if that's okay.
Yeah,
because
but obviously this is something which is obviously important, so that's why I'm asking the question.
Well,
Councillor Luca, can we wait till the end of the presentation, please?
Yeah. So our vision is that we want children to be happy, healthy, loved and safe, and you've got the mission, the shared values and the shared expectations. Collaborate, learn, resource and include and mutual challenge. So that is the kind of reference to that co-production. So we want children to be happy, healthy, loved and safe. I don't think anybody would argue with that as a vision statement and an ambition. That slide describes who we are. How do we do this? So we meet regularly to talk about how to make things better for children and also to listen to what families have to say to make sure that their needs are met. And we've got some engagement with families who have in essence, experts by experience. So through their experience, they have an expertise and an understanding of the system, and we use that to support our development and our change, different approaches, different ways of doing things. And we've had a number of events this year to ensure that we are listening and reflecting both to our young people through our participation group, parents and carers through our Parents and Carer Forum, but also some specific groups of parents that work with us, particularly around child protection processes. So we're very much holding partners to account about the way that they work, so from teachers, doctors, police officers, voluntary sectors, to ensure that people understand their statutory duties and that they understand how they can get support, advice and guidance when they are concerned or have concerns about children. That shows you partnership structure. I think we've got that in your papers, but you basically have got on the middle section of this slide and I'm looking at this one because I can't see that one even with my glasses on. So you've got the obviously the local safeguarding partners, and then the executive group, the quality assurance groups, and then around underneath and to the right, you've got all of the other boards that have an overview and an insight. So this function in this annual report is talking to you about the safeguarding partnership. There are other priorities that sit within, and statutory duties that sit within the Health and Wellbeing Board, that sit within the Corporate Parenting Board, the Youth Justice Management Board. So it is a complex structure, and we deal with different areas and priorities within different boards. So the annual report that you see today is really asking, are we meeting our statutory duties as defined under working together as a multi-agency safeguarding partnership? So our co-production promise, which is central to the work, is that, as you see, people with responsibility providing support, sharing their power by working with those receiving that support at every step, so the help provided is as good as it can be and makes life better. So this is a promise that has been, as you might imagine, co-produced across all of the partnerships. So this co-production promise is a Staffordshire co-production promise and really informs how we work with families. And the new legislation that we are working towards now, so the Department for Education have a new Families First programme, which will influence the work, the operational work of the key partners, that is very, very much enshrined in working with families at the right time, delivering the right services, and ensuring that we are adapting our services on the back of the feedback. But what I would say is, this is a statutory service, so we investigate child abuse across the partnership, so it can be a contentious area because it's very difficult sometimes to engage in truly co-produced outcomes when you may sometimes be dealing with challenging sets of circumstances. But we seek to listen, we seek to support families, but fundamentally we are here to safeguard children and ensure that the statutory partners and the wider partnership deliver that function. So our priorities for the partnership are a focus on the integrated front door. So for those of you that have been in previous scrutiny meetings, and there's not many of you, but we have moved from a multi-agency safeguarding hub approach in children's services to an integrated front door, and there is an improvement plan in place really to improve our approach and accessibility to agencies and the public for making referrals where they're concerned about a child. Vicky and I were actually in Lindham House yesterday with our teams, and our teams are co-located there, and we were also there, not with Steph, but with one of Steph's colleagues, Sharon Conlon, because we regularly engage with our teams in that integrated front door. Our other focus is contextual safeguarding, and we've got a new strategy around our engagement around child exploitation in its broader sense across sexual and criminal exploitation. We've got a learning hub, and we've seen a reduction in missing episodes, and the ambition is that we continue to work and focus on that. We've got a joint self-assessment and an action plan for domestic abuse, and we're really wanting, over the course of moving forward now, looking at strengthening our child focus in relation to domestic abuse. And then we have something called a graded care profile, which we use to assess families, children, when neglect is a feature, and we want to, we're increasing the number of our assessments and really wanting to increase the confidence and knowledge of the workforce in related to neglect. So we have something called child safeguarding practice reviews across the partnership, and they are reviews when we want to learn from the work the partnership has done with families and making sure that we improve how we engage with families and how we ensure that we continue to maintain high standards of both assessment and investigation where children are at risk. We've had 49 child death notifications, which have reduced from the previous year, and there is a whole kind of body of work in that space and a significant separate kind of group that deals with child deaths. We continue to work with HMYOI Warrington, and we have reviewed and continue to review on a regular basis restraint practice. And when I say review it, we proactively watch kind of body cam footage, not us, but members of our teams, to ensure that young people are being cared for safely and the activity at Warrington is being managed effectively. There is a Youth Justice Management Board, and it's really important to understand that a lot of those discussions about Warrington and what happens in Warrington and what happens for our young people who may be in custody or who may be receiving a service from the Youth Justice is managed through the Youth Justice Board. In the Safeguarding Partnership, we're looking at how children are safely cared for in that, and as a result of that, a number of us have visited Warrington, met young people, met staff. We regularly have engagement sessions with the Governor of Warrington. And then we engage as a partnership in a significant amount of multi-agency training, which is evaluated to make sure that, one, that it's relevant, that we provide the right training, and that we increase our multi-agency training, so our various operational staff training and learning together. So the next steps, can I look at your papers because I can't read those slides? Thanks. So this is really the plan on a page with our priority outcomes for the next 12 months. It reiterates the vision that I've talked about and our shared values, again, that I've talked about, and shows the area of focus that I've just referenced in the last slide, and really focuses on core business. So really important, the Safeguarding Partnership doesn't cover everything to do with children. It is about the safeguarding of children and us delivering the duties of working together and the working together legislation. We do have independent scrutiny of our work, so we don't sit in an ivory tower just reviewing and scrutinising our own work. We come here for the purposes of scrutiny and challenge, but we have independent scrutiny and auditing that regularly review the way that we work together, the way that we work as a partnership, and the way we effectively safeguard children. What I would like to say is that across the three partners, we have an incredible number of very committed staff who work tirelessly to ensure that children are safeguarded. And we're joined just behind me on my left by Lynn Milligan, who coordinates the business management function for the partnership and leads a very small but very effective team to make sure that we are compliant with legislation, that we have a forward plan throughout the year of how we meet, when we meet, how we engage. And the work that Lynn and the team do is incredibly important, but it's done incredibly effectively given that it's such a small team. Thank you.
Thank you very much for that presentation. I would just like to start off questioning, if that's okay. I have read the report and it does cover what you've done to, for improvements, things like that. I do feel it falls a little short on tangible data, and I'll give a brief example. On page 19 of the report, it states 70% of Staffordshire children are ready for school at the end of reception. That's fine, but it doesn't mention where the other 30% are. And also around 250 children were permanently excluded from school, but it doesn't say why. And then as another example, on page 30, just a second, it states that over the last 12 months that you've done a thematic review that was conducted into suicide, but it would have been nice to have seen the findings of that, which aren't in the report. So if you could...
So I'll start.
Yeah.
So this report gives you an overarching view for all of those elements that you talked. So the early years data around school readiness, good levels of development, and the new government kind of legislation is dealt with by our early years team, who will have the micro. If we put all of the kind of contextual data in about school exclusions, etc., then this would take away from the focus, which is safeguarding the overarching work of the year. But there is more detailed information around school exclusions, and I think, and Helen will correct me if I'm wrong, but I think we have another scrutiny session on that very specific issue around education, and that would be covered in that specific issue. And then I'll hand to Vicky to respond to the suicide.
Thank you. I think it is important to remember this report is an overview, but I absolutely appreciate on some of the really key issues, such as child suicide, that are incredibly important, that thirst for further information and assurance. So the Child Death Overview panel for this reporting period was actually chaired by myself. It's now chaired by Public Health as of the 1st of April this year. And one of the duties, statutory duties of that board, and it's a subgroup that reports into our overarching partnership, is to provide an annual report which details all of the specific things that the board has done within that reporting period, any work that's been commissioned and areas of focus that have been identified. So in due course, you will receive a separate document from the Child Death Overview panel that will outline all of the detail that you're seeking, specifically in relation to suicide. But to put that into context, there was 49 children, 49 notifications that were made to the Child Death Overview panel during this reporting period, which was a decrease from 64 the year before. The two highest categories of child death that reported into that board was, number one was children under the age of 28 days, so our neonatal children that died very early in life. And then the second cohort was aged 10 to 14, where we saw a significant increase of deaths within that age category for children that have died as a result of predominantly road traffic accidents and also child suicide. That is something that was incredibly important that we looked into further. So as a consequence of that, we did commission a review using the National Child Mortality Database methodology to understand the complexities of that and what that meant for our children in Staffordshire. That review was completed, and there is actually a working group that I chair to drive forward tangible activity and outputs as a consequence of some of the findings from that review. However, this report obviously goes up to March 2024, March 2025 I should say, and the working group is ongoing. So in terms of the outputs of that review, the activity that's underway and the impact of that work, that you will see that featured in next year's annual report. However, the Child Death Overview panel will give you the context and the reason as to why that suicide thematic review was commissioned in the first instance.
Hey, Councillor... Oh, yeah. Councillor Luca, if you'd like to ask your question.
Yeah, obviously, the co-production. Can you tell me, because you've said that you've worked with these people, but what is actually the percentage that actually from the speaking to the people and the real-life experience users have you actually integrated to this report, and going forward on it are going to actually put into forward plans to provide a better service?
Okay, so I can't give you a percentage. I can talk about how the various groups across the county that we engage with and how we respond, for example, to some of the complaint feedback that we receive from families, and how we operate as a safeguarding partnership, because that's what the scrutiny is about. There is a whole wider system co-production work that happens through the SEND services, through children with special educational needs and disabilities, through our education colleagues, and through our wider participation programme, which is called The Voice for children and young people. We have been reviewing in the safeguarding space a more bespoke complaints process, particularly for those families who go through a child protection process that they are either unhappy about or they feel was unfair. And we've just very recently dealt with one family and are reviewing our bespoke complaints policy. So we have a corporate complaints policy for children's services, and we get complaints about a whole range of interactions that we have with families that people might be unhappy with. We also get compliments on occasions because people are actually happy with the way that we do work, and it's important to remember that. People do have good outcomes from these processes, but equally it's important to acknowledge that not everybody does. So we have, as a result of actually only one family and their experience, started to review how we respond to very specific complaints about child protection processes, and that will come forward in next year's report. But we are very engaged across the wider system. We've got a parent carer forum for that Councillor Higgins, who's behind me, is very well aware of and linked into through the special educational needs and disabilities. And we have groups operating through some of our provider colleagues in the health service, through MPFT, that have proactive engagements. I was at an event, we did a number of events across the county with parents, carers and wider partners about how we engage, how we listen to families, and how we think about how we might adapt services on the back of that feedback. As I said at the start, very difficult to change statutory processes, so investigating child abuse is fairly fixed in terms of the way we do that, how we do that, and the outcomes. What we can adapt is listening to families, feeling that families have a voice, and making sure that all families who attend, for example, child protection conferences, have the ability to have an advocate with them and are aware of their right to have that advocacy in those spaces. But there is more extensive work around co-production outside of the specific nature of the Safeguarding Partnership.
And also, which is part of this, safeguarding. What are we doing about safeguarding from missing from home, considering that we have not been actually investing into that?
We have been investing into that. I've got, well, I think it's probably a conversation outside of scrutiny on the missing from home, because I've just, Councillor Screen and I have had discussions about this very issue, and there's some work being done around how we commission services for missing from home. We've got 2 different operating models for missing from home. We have an operating model for children who are missing who live outside of Staffordshire, so children that are in care that live outside of Staffordshire, and children that live within the Staffordshire boundaries, and then children who are not looked after but who go missing. And we have recommissioned services, and we have brought some services in-house, but we haven't disinvested in services for missing children. But I'm very happy to respond to that outside of this meeting, if that's helpful.
Thank you very much, and good morning, everyone. Yes, really, Bernie, it's good to hear you talking about Warrington and the young offenders, because it's been in the national newspapers, as you know, about the way that they've been organised, looking after our children, because we have got children in care, I do believe, in that young pit. So have you had any comments back from our children, that they're, I know you've mentioned it in your report, but are they quite happy that they're being looked after okay? That's my first question. My second question is, you talked about children missing from home, but I worry, and I think you've just mentioned it actually, about the children that go missing from our that's placed in care and in our homes and what have you, and they go missing in the middle of the night, and as you know from the police, you can't do anything about it. You can't stop them walking through that door, and yet at the other side of that door is probably people waiting to pick them up and getting them involved into crime, and that really, really concerns me, because I've been in situations when we used to do the visits and found children have gone missing at 2 o'clock in the morning, and I think it took about 8 weeks to find one child, you know, so I'm really concerned about that. And the other thing, the third question is about, and this came out yesterday because I went to the Midland Partnership Foundation Trust AGM, and there was a gentleman in the afternoon talking about prison and drugs, and he was saying that he'd got a child 2.5, and he knew, because he'd been through the prison system and everything, and he knew that that child would be looked after. And well, he says, but what concerns me, I've got a brother, family member, who's got young children, is involved in the drug trade. He says, and I can see these children being brought up into that sort of situation. So my question really is, how do we protect these children that you know, as the police know, that these mothers and fathers are involved in a drug situation? You know, how do we protect those children so they don't fall into that gut? Very difficult question, and I know it's a very difficult question to answer, but, you know, I would like your thoughts on that. Thank you.
So I'll try and remember all of those elements. So, as the statutory DCS for Staffordshire, I have a statutory duty in relation to the safeguarding functions in Warrington. Warrington tends not to have Staffordshire children, so a lot of the children who are in custodial settings are from London, the West Midlands, and wider areas. We have a very low rate of children in custody in Staffordshire. It varies, but a lot of our children that are worked with in Staffordshire who have engaged in criminal activity or are on the periphery of criminal activity are not generally in custodial settings, and if they are not generally in Warrington. But when I went to Warrington, I did meet with a number of young people, and they raised a number of issues with me about their care, and I, as the statutory Director of Children's Services, then contacted my respective Director of Children's Services with the children's permission in the areas where they live and belong to. So, and had responses, and that responsibility to do something about that individual child sits with the Director of Children's Services in the Home Authority. But it's incumbent on me to ensure and hold Yasmin to account, the Governor, for the delivery of safeguarding, and to make sure that children who are living in our county, albeit in a custodial setting, are being as far as possible cared for. And we have regular meetings with the Youth Justice Board. We have a representative of the Youth Justice Board, so their national kind of governing body sits on our own Youth Justice Management Board, and we actually met as a Youth Justice Management Board this week. So that's Warrington. Missing. So in relation to return home interviews for children in Staffordshire, they sit with our commission provider, Trinity Support Services. Children outside of Staffordshire receive return interviews from our own operational staff, so social workers who have a child that might be living in Leicester who has a missing episode, they will go and do that return home interview. We have mandated, and our expectation from any commission providers and our own staff is that those return interviews are face-to-face, because we need to understand, why is the child going missing? It links into your other question around exploitation. You know, is there something happening where people are waiting to pick children up? If so, that's a criminal matter, and that would be investigated as a criminal matter. If we've got care providers who think that there's, you know, adults hanging round, adults in the vicinity, cars, people are quite astute these days and quite aware of those extenuating factors. If we see children coming back into children's homes who've got a load of money or phones or things that maybe they don't really have the ability to afford, then those kind of things would come to our attention, and they would be investigated. Between 23 and 24 and 24-25, we saw a 20% reduction in the number of children with repeat missing episodes, so that's positive. So when children are running away, they're not repeatedly running away. We appear to be able to have those conversations and mitigate those risk factors. Sometimes that involves in children being moved placements, because sometimes the risks are about a local area, a particular area, and we act on that. Almost 80% of children who experienced a single missing episode did not go on to have a further missing episode within a 90-day period, so within a 3-month period. And that was after the completion of a successful return home interview commissioned by our provider, Trinity. In the last 12 months to June 2025, 25% of missing episodes were for children in our care, and they were found approximately 13.8 kilometres, that's very specific, isn't it, away from where they were living. Generally, they are trying to get back to their family, their local area. Now, that's either because they've got very strong connections with their family, or they've got strong connections with people that we would prefer them not to have strong connections with. But that, again, would form part of an investigation as we gather intelligence. And we have a lot of intelligence between ourselves and our police colleagues and that wider system. Has that covered everything? Oh, children living at risk with people who are offenders. Well, that is all about how we become aware of that, if we're aware of that, if it's raised as a concern. We have a number of children who may be on child protection planning, where there are concerns about the activity of their parents. But, you know, the starting point for children is that their parents have the first and primary duty to care for and be responsible. And where that is called into question, and there is evidence of significant harm as defined in the Children Act, then we are in a position to investigate that, and sometimes, where agencies agree, place children on child protection plans. But it is a very complex process, and it's got to be based on evidence, not anecdote. So, you know, we have people who come and say, Bernie Brown's mum is doing X, Y, and Z, but actually there needs to be an evidence trail of that, and not an anecdotal report, because people, you know, not all reports we get are based on fact. And our job, and a very difficult job of our staff and our teams, is to investigate that, to analyse that, to work with families, and to support families to make different choices. And I think we do that very well, and we signpost families to support services. We've got an amazing family hub programme in Staffordshire that support families. We've got a lot of parenting programmes. We've got a lot of support programmes for adults who have addiction issues, and we have extensive services to support women and men who are subjected and at risk of domestic abuse.
Councillor Wallens, I believe you have a question.
Thank you, Chair, and good morning to everyone. I've got a couple of questions I'd like to ask, but I'll do it in a two-part phase. The first question I'd like to ask is, you know, the Voice of Children findings, are they turned into specific measurable actions like safe spaces and youth activities, etc.? And also, I'd like to request more detail on how the new integrated front door will reduce referral delays and what performance targets will be monitored.
So, first question, we have a corporate parenting panel which looks at the feedback from our young people, and we also have a wider youth council which is managed by Skivvies on our behalf as a kind of umbrella organisation that looks at youth, and there's quite a lot of proactive work going on across the county through those through Skivvies and those wider youth providers around listening to young people's feedback, particularly in rural areas, around what is available to them for support, but that is sometimes a district council issue, not a county council issue, in terms of community centres, what's available. But we do work with our district councils to reflect back feedback from young people about what is available to them in communities, and certainly through our participation service, our Voice programme, they have a comprehensive work plan that goes into the corporate parenting board. Some of your member colleagues will sit on that corporate parenting board. That assurance sits with that board. In relation to the integrated front door, we have there is a scrutiny session. Helen will tell you when that is, but I know the papers are required for Friday, so it's soon, and we have an improvement plan which we will be sharing with members that outline some of that work and how that work is monitored, tracked and quality assured. It's also monitored, tracked and quality assured through a regulatory process, so we're inspected. Our police colleagues have been inspected through that child protection lens, and we will be inspected imminently around our decision making and wider service restructure and changes through the integrated front door. There's a whole programme of work that will come to scrutiny under that integrated front door focus, and hopefully you'll see the more detailed answers. And I also know that there is a visit planned for scrutiny members to the front door. So what I would say, and I know Helen is going to rehearse this with you, that is a secure setting. It is a police building, and so you can't just turn up and visit the integrated front door, which is why we're coordinating a collective visit for you that we will manage entry, guided kind of tour where you'll be able to talk to staff and talk about how that system operates. I think both kind of my leadership team and the police leadership team will be part of that, and health colleagues who are also co-located there will be available, and you'll see that as it's kind of developing. Again, this report, the scrutiny report, is looking back. We didn't have an integrated front door last year. It is something that we've been working on in this 12 months, and so the impact of that will be reported in the scrutiny report for 25-26.
Cheers, thank you for that. And the second part of what I want to ask is, I'd like to suggest adding a section on how financial pressures and staff shortages are affecting safeguarding capacity. And also, in next year's annual report, would it be possible to include a lessons learned and impact tracker, so like counsellors can see which recommendations was acted on and so forth? Thank you.
I'm happy to take those suggestions away and think about how we might incorporate those into the annual report for next year. Lynn and I and the partners can have a conversation about that, so thank you.
Councillor Kelly.
Hi. So I've got two questions. My first is, I think it's great that the mortality rate have gone down, but I think if we'll all agree that any preventable death, especially with a baby, is not great. So how do you think, I had a baby about a year ago, and I found that when I had to go to do maternity services and try and go to get, to go and get weighed, and you go to the care and you go to those services, in rural areas especially, they are hard to get to. 8 weeks after having a C-section, you can't drive, you can't get out. And it is far more nowadays where you have to go and do that. Before, there used to be more home care. They used to come to your house, they used to come, and perhaps if that was increased, then we could see what could be done to prevent those deaths of infants. Secondly,
that one first,
yeah,
so we don't forget what. So what I would say is, I very much appreciate the question. Probably not for the safeguarding board, but I know Steph will probably want to respond to that as the ICB representative.
Thank you, and thank you for the question, and appreciate it's obviously very sensitive. I think, you've raised something very, very relevant in terms of how services are provided now, and under, a lot of workforce pressures, etc. But I think with regards to maternity services, obviously they play a huge part in ensuring that mums and babies are well and throughout the antenatal period and postnatal period, of course, and they do have a universal offer in terms of those home visits, and you know they are regulated, so they have to follow those contact times. But also I know that if there are extraordinary circumstances, they will enhance those visits and periods of time that they'll spend with families. And there's an awful lot of communication that goes on between maternity services and 0 to 19 services, so that you get that follow-on care, and also antenatal care. 0 to 19 services are involved in antenatal care as well. So I think, you know, we're very fortunate, I think, in Staffordshire that we have such, you know, a robust service with regards to that. But I think you're absolutely right in terms of preventable deaths. You know, we do our utmost to ensure that parents are educated as much as possible with regards to safe sleep. We have the ICON service, which is supporting families to manage to care for babies who are crying all the time, you know, in terms of keeping them safe and, you know, taking a step back and a bit of a breather to cope with that. But of course, some of these deaths are not preventable, because these are babies that are born either very early and don't survive as a result of that, or they have a number of conditions, which means despite all the healthcare available, they do pass away. So I'm not sure if that's answered your question, and I'm happy to discuss it after the meeting, but I don't know if Vicky wants to carry on with that response. Thank you.
Just a point on prevention, really, because I think it is incredibly important that we understand the role of the Child Death Overview Panel in the context of the partnerships and where that sits in terms of prevention, because any child that dies is an absolute tragedy and significant loss for that parent and that family, and something that is incredibly important to us. I think we can be proud in Staffordshire for the Child Death Overview Panel. We've got a multidisciplinary team that is absolutely driven to identify any preventable or modifiable factors that we can collectively make a difference and make some change for families for the future. But what the Child Death Overview Panel does for every child that dies, when we talked about 49 notifications, that's quite a significantly large number. However, it's important to remember that all of those deaths were not unexpected. So some of these were really ill children that unfortunately may have had a medical condition that meant that they died very young. Now, only 31% of those 49 that we reported today had what we call a multi-agency response, which meant that their death wasn't expected within 24 hours of death. And that is where our collective efforts as partners to try and understand why did that child die is incredibly important. So for reassurance, when any child dies, for every 49, one of these children that have died, all professionals sit round together and we review, was the service provision appropriate? Did we do everything that we could do as professionals to be able to care for that child and provide the support that families need? And the families are intrinsic to that. So from a preventable perspective, parents absolutely do tell us if there's any issues with access to services, what the community provision is, what care they received in the hospital setting, what medical intervention took place. That gets thoroughly reviewed by the hospital and overseen by the Child Death Overview Panel. We then also look at factors intrinsic to the family, so things that only are relevant to that particular family unit. So what happens within the family home, and were there any preventable factors within the family setting environmentally that we could look at, that we can problem solve as a partnership. And that's when the report talks about modifiable factors, and that's things like, was there a history of domestic abuse? Was smoking a factor? Was maternal obesity a factor in the death? Now, it doesn't mean that those modifiable factors caused the death and that child may still have sadly died. But what it does mean that when you look at that in the totality of how many of these cases in Staffordshire had modifiable factors, it gives us areas of focus as a partnership to look at where are the true areas of prevention. So as a partnership, you'll see in the Child Death Overview report, we really look at where can we have the biggest impact in terms of prevention, and how we hold partners to account end-to-end through this process to ensure that if something was preventable, that we recognise that and we start to make a difference moving forward.
Thank you. And then my second question. As we know, abuse can happen anywhere, whether in an affluent family or in a deprived family. I've seen a lot here about social care in children in those What about in private schools and private education? The child may not feel that they are able to go to the teachers. Every single person they're around is someone that their parents are giving money to. And there may be bias as well. I mean, it is hard to say when a child is in a private education, there is a perceived view that they are well looked after, and that may not always be a case. So what is being done to prevent the bias and in those situations, what are the safeguarding there?
I think that's incredibly important, and I think through the support and the engagement with our colleagues from education, I think that is how we're going to be able to reach into some of these children. So being able to go into these settings to engage with young people, to understand their views, to provide the opportunities, and it's about that, providing the opportunity for children to feel they can speak up in a safe environment where they won't be judged or questioned by people that are looking after them or responsible for their education provision. We absolutely look at the lived experience for that child, for any concern that is raised, and we try to break down those barriers. So for every report that comes through to us as a partnership, we'll really sensitively think about what is going to be the most effective way to engage with that child. Sometimes it may be in the education setting, sometimes it might be externally in the community, or it may be elsewhere. And I think that's where we look to problem solve, how we engage with young people, regardless of the setting, education setting where they come from, to think about how we can get the best from our engagement and then make children feel that it's okay and they can confidently, with transparency and trust, know that we will respond on their concerns.
Councillor Luca?
Yeah. Just to feed on that, I'm actually a parent that did actually bury my daughter through medical neglect. This is going back in 2005. So from what you're saying, I'm very pleased to say that you're learning lessons and moving forward, but mistakes are still actually being made. And I'll give you what happened with my own daughter. She was 38 weeks and 5 days, my partner, and she started bleeding. So we phoned up asking for advice, and she was told, oh, don't worry about this, nothing to panic about, you're just spotting. She was actually having an abruption. And then as for the ambulance showing up, I managed to travel all the way from Tamworth to the Russell Hall Hospital in Dudley, and I was only 2 minutes behind the ambulance arriving. So I would actually, say this is something that never needs to take your foot off the gas. It's something that you're always going to have to look at. But I do appreciate that you are doing that and you are moving forward and trying to make it safer, because I didn't expect that the only thing I'd ever buy my daughter was a casket. Thank you.
Thank you for sharing that. I'm really, really sorry for your loss, and I think as a bereaved parent, it's incredibly brave for you to have shared that story here and your lived experience of that. I hope that our Child FOView panel is doing justice for all the children and families in Staffordshire, because a loss, as you've just articulated so powerfully, is incredibly important to you, your family. And if there was lessons to be learned, absolutely, we should be listening to those concerns and responding. So from a health and social care and police perspective, that is where our child death arrangements are so incredibly strong, because we are not united in our vision to ensure that if there was anything that we could have done differently, that we reflect and we learn from that, and we do that quickly, which is really, really important. And also including families in that as well, which is something that we do on a regular basis, because we want to hear people's experiences so that we can help understand and explain from parents' perspectives when we're thinking about processes and change that we're making for the future. We have got really robust review processes within our health trusts, and there is a really rigorous process that takes place when any child dies, and then that gets reported back into the Child FOView panel, where we give that overview, that scrutiny and that reassurance. So I am confident that if any issue such as that happened in Staffordshire, that we would have acted upon those particular issues, and we will be seeking to remedy any of the shortcomings that may have been identified through our reviews.
Thank you.
Do we have any further questions? Councillor Nixon?
Morning all, and thank you for the report. The concerns raised at the Warrington facility, particularly the ones raised by the boys, is there any evidence it will substantiate what they have claimed regarding racial bias, regimes, etc.? And if so, what is the plan to remedy this, bearing in mind that this is a rehabilitation to get these children on the right course?
So again, that discussion and that oversight of Warrington is managed generally through the Youth Justice Management Board. That is attended by a whole range of partners. In fact, your colleague, Councillor Lakin, was at the Management Board on Tuesday, I think it was, this week anyway. It's been a long week. There is a whole series of documents and engagement with Warrington in relation to the national issues that are raised that are being overseen by the Youth Justice Management Board as part of their oversight and their inspection processes. So the Warrington is also visited by the Howard League. In fact, the day that I went, the Howard League were on site in Warrington talking to young people and looking at their issues. In relation to the issues that the boys raised with me, that was about very specific links to their youth justice work, as the visits, because the young people are entitled to so many visits, they're entitled to for their parents and their families to be supported to visit them, and they're entitled to a certain amount of financial allowance each week, and they were raising issues about not having that. That is a matter for those individual local authorities to deal with. I wrote to the DCSs, and they have actioned and engaged with those young people on an individual basis. So in relation to that, in terms of the wider issues that were raised through the inspection process that you've seen reported in the press, they are being dealt with as part of Warrington's own regulatory inspection processes, and that will be monitored through the Youth Justice Board. We obviously monitor the safeguarding element of it in this as part of this work, and our operational staff review on a regular basis, particularly the restraint issues. And you may have seen reported in the press that in some youth offending institutes, they have introduced the use of a spray called Parva, which is used to restrain, like to support a restraint and to, I can't think of the word, but basically to de-escalate. But it is a fairly contentious approach in a youth custody estate. So the Howard League, the Youth Justice Board have all challenged the government's kind of implementation of that in key settings, and we certainly as a Youth Justice Management Board are monitoring the use of Parva as part of the kind of restraint and overview processes. But I would want to assure you that certainly myself and Vicky are take a very close interest in our overview and scrutiny responsibilities from a safeguarding partnership perspective.
Thank you, Chair. In relation to the spray that is used, what is it? Is it a pepper spray? Is it, well, I'm trying to think of other variations of sprays being used, but the only one that comes to mind is pepper spray. Is it pepper spray? Thank you.
Forgive me, I don't know the chemical component within the spray, but the Parva, obviously, if you put that in online, it will tell you exactly what is included in that. But in terms of the specifics of what is in that chemical, but essentially it's a de-escalation tactic, so people don't need to be physically restraining young people. It can be used as a deterrent to make children stop engaging in violent activity, or to break up or disperse some violent activity that has taken place. There is a really robust strategy and plan in place within the Warrington estate as to how that can be used, when it can be used, the training that's given to staff, the scrutiny that follows should it be used. And that is something that we will be reviewing through the Review and Restraint Board. So if you have any specific questions in relation to the product that's used, I think Bernie's just Googled it for you. Yeah. We can certainly share that separately.
It stands for, and excuse my pronunciation, pelargonic acid vanillamide, and it is a synthetic non-lethal irritant incapacitant used by the police and obviously youth offending institutions now as a tactical option when they cannot use other forms of force. It works by causing severe pain to the eyes, temporary blindness and breathing difficulties described as wet fire. The focus stream of the spray minimises risk to bystanders compared to other irritants, making it suitable for confined spaces and situations where other protective equipment isn't an option. And that is why there's been so much challenge about it, because these are children that we're talking about in youth custody estates. However, because of the pressure on the adult estate, there are still adults in Warrington and other youth custody estates, so it's not as straightforward as it may seem. But I think the challenge around the use of parva and the introduction of parva has been, we as a partnership wrote to the government because we have safeguarding duties to express our concern about the introduction of the spray, and it has been challenged by, as I say, the Home Office and the Youth Justice Board, you know, very, very robustly. But as Vicky says, there is a whole escalation criteria about when it can be used, how it can be used and why it can be used.
Thank you. And it's more of a supplementary question. What is the procedure of obviously the people who are trying to use the gas, and the spray, sorry, and you say it causes breathing problems and temporary blindness. Let's say the kid was asthmatic, and in the case of the officer, whoever it is that obviously does the spray, and the kid dies because of respiratory issues, who is legally responsible for that cause of death?
Well, that's a very contentious question. I don't think that's one for scrutiny. You know, I'm not going to start to answer a question that I don't understand. I think if councillors want a response to that, they really ought to write to the Governor of Warrington and ask for clarification on use of parva and an explanation of the escalation processes. That would feel more appropriate for me, because if I started to answer that question, I will get it wrong, and particularly in terms of, you know, any death in custody is investigated robustly, that is not within my remit in terms of the investigation of that. And I wouldn't want to start to second guess who would be accountable, because it would depend on the circumstances and the environment.
About the procedure aspects, you know, going back to part one.
You need to write to the, if you want an answer to that, the Governor. I'm not responsible for how that is, you know, the way that is delivered. It's not a safeguarding. It's not related to the safeguarding report, and I think it might be the right question, but it's in the wrong place. And so I think if Helen can support you to access the Governor's details, I'm sure that Yasmin will be very happy to provide a response.
Thank you for that response. Can we move on to Anne Edgiller, please?
Thank you. Well, one councillor shared a story with you about family, and I'll share mine because I think it's so important, and I plead with you all to make sure that children, I adopted a boy with special educational needs, brought up by a paedophile, shall I say, to start with, and he was put into prison, this paedophile, and this child actually didn't get the help and those formative years up to 9 years old when he should have got the help. I'm going back a few years, and I do appreciate all the good work that's being done now, because I've lived with this situation for 30 years really, and I really appreciate the good work now that the County Council is doing apart with children in care. But this child, as I say, was a warder court. I adopted him, and in the end, it cost him his life because he got involved with the wrong people and what have you. He ended up in prison, and to cut a long story short, he was actually murdered in prison. And when you talk about custody being really investigated, the Ministry of Justice say it's not their responsibility, but that's another situation I'm fighting. But the reason he was in prison, and that is because he hit this man and nearly killed him actually, but the guy did forgive him. But at the end of the day, I said to him, did you think you was hitting this paedophile person? And he said, yes, Mum, I did. Because that child didn't get that help in those formative years, it came out in him in his later life. He was 37 years old, and he was stood cracking eggs in a kitchen, and a guy that was suffering from, I can't remember now, some mental condition, walked across the kitchen floor and just took a 10-inch blade into his side and killed him on the spot. It's something I'm having to live with, and it's not easy. And this is why I'm really, really conscious that we give as much help to children in care, especially if they're in, I mean, I said about families and children living with people with drugs and everything, you know, and what help do we give them. It's same with somebody living with a paedophile, you know, what help do we give them? I implore you all to do everything you can to protect these children. Thank you.
Thank you for sharing that very sad story, and I'm sorry about that. I would like to think that things have improved in the safeguarding context, and I think we would give, you know, an assurance as far as possible that our staff do their very best in very difficult circumstances every day of the week to safeguard children. That doesn't mean that we won't ever have an event or a tragedy, because sometimes that is beyond and out with our control.
Councillor Fantini?
Can I just ask quickly, can you just reiterate to me the age range that this chemical is used on, like with the children? What's the age range?
Well, it's children that are in custody in Warrington, and a number of other, I know Feltham have used it, but a number of other custodial establishments, and so children that are in custody within those establishments. It's a little bit variable at the moment because, as I say, there are still young people who transition into adulthood in youth offending estates, so they would be there'll be a broad range, but some of them will be children. I'd have to go back. At the moment, we've got a wide range of age groups of children in the Warrington estate, which is our local one. But obviously, youth custody is for young people. So, but it then ends up there will be adults in that estate as well.
Thank you.
Councillor Wayne-Luca?
I appreciate that we've done a lot of work, and yourselves have done a lot of work in safeguarding, but are you actually aware that there is actually still a safeguarding gap with out of school and out of regulated clubs when people are coming, and it's affecting music clubs, dance clubs, martial arts, sports, and there has been quite a few reports on it. And I'm actually working with the British Dance Sports Association at the moment on trying to see what we can do as a council to try and actually close this loophole that they're working within. Are you aware of it? And if you are aware of it, what are your actually plans to close this loophole gap?
What loophole is it that you're referencing? If you could give us some details on.
Yeah, what I'll actually do for you, Bernie, is I'll give you a full, I'll give you the full book. Okay, and this book's been put together by the British Dance Sports Association, identifying the issue, and even actually they've come up with a framework that can actually be adopted, which would actually it's not going to stop safeguarding issues altogether, but it would make it a lot harder for these organisations which are operating outside.
Can I just stop you there for just a second?
Sorry, all members were sent at the beginning of July, perhaps, an email from a gentleman who said he was working for a dance association. And Helen Arnold very kindly sent a copy to me, I've contacted Phil Pusey, and he is going to meet with members. I haven't organised that date yet, but it'll be sort of later on this year to explain his role as skivvies and the work that he does on behalf of the County Council and his connection there. He recognised when I forwarded the email to him some of the dialogue that was in there from things that had been passed around before. So as a starting point on this, members are going to be meeting with Phil Pusey to understand what his role and the County Council's role in safeguarding for those voluntary organisations.
Okay, because they operate an umbrella function to support governing bodies to have all governing bodies have to have safeguarding policies, and that is the responsibility for that is on them. We do support some of those governing bodies through Phil, but also through the guidance within our safeguarding policies, and Phil will explain all of that. It may be useful for Lynn to be invited to that meeting because there are resources that are available, but the governing bodies have to produce their own safeguarding policies. They have to have a safeguarding lead. So if I just speak from my own experience, football, our football teams that my boys play in have safeguarding leads within that who are responsible for looking at the recruitment of any coaches and the police checks. They happen in all governing bodies, and there's an expectation that those governing bodies have those robust systems and follow the guidance of some of those national governing bodies. So gymnastics, the FA, those bigger, they all have those safeguarding duties and responsibilities that came from obviously some very tragic experiences where children were abused by people who targeted youth-led organisations. And obviously people will always continue, people who have a predilection for abusing children are going to attempt to target and engage in supporting activities where they have access to children. But the duty is on the governing body but as a local safeguarding partnership and as a voluntary sector organisation, we do provide umbrella support to those organisations with templates for safeguarding policies and support. And obviously, if people have any concerns, they have a responsibility to report those concerns to allow us to, where necessary, investigate them.
Okay, thank you for that. What I will ask you is would you like a copy of this report?
The team can have a look at it, but I think Lynn will be very happy to support the meeting with Phil so that we understand what the issues are that are concerning people.
Thank you.
Councillor Edwards.
Might not be able to answer it full, but the Baroness Casey's report, has that had any major effects on the work you do with child exploitation or grooming gangs, so to speak, or anything like that? Any investigation?
Thank you. I think it's a really important question, and it's something that's very much in our mind at the moment in terms of professionalising practice and looking at how, as a partnership and also within our own respective agencies, we reflect and we respond to Baroness Casey's report. So from a policing perspective, we've got 2 dedicated child exploitation teams on the north and the south of the county. The Staffordshire child exploitation team works co-located with colleagues from Children's Services. As a partnership, it's our duty to ensure that our child safeguarding exploitation subgroup is working with real clarity, real focus, and really meeting the needs of our communities. So the Baroness Case report has been received into the partnership. We have looked at that report, sought to see where we sit in terms of the recommendations, and then from a reassurance perspective, our role as senior strategic leaders is to ensure that our vision and our strategic direction and our plans that our teams are working to very much embodies some of the learning, the reflections and the focus that Baroness Casey is seeking for us all to apply to any work that we do with children and young people in our communities around criminal or sexual exploitation. So I can reassure you that we have received the report. We are working to service any national requests that are coming from ministers into policing and out into the partnership. We are maturing our partnership arrangements, and our delivery plan, which we've currently got, that defines the activity that our teams do in this area, is very much being reshaped in line with Baroness Casey's report. So in due course, and I would imagine in the next annual report, you'll see quite a significant shift in terms of our focus around sexual exploitation. You'll see the areas where we are making the significant impact and how we are really professionalising practice, strengthening our workforce to ensure that we understand the complexities of this area, our staff are equipped, and we're engaging with the most vulnerable victims at the earliest opportunity.
Councillor Luca.
Okay, this is one for the ICB. The 306 million that the NHS have been told that they need to save, is that going to have an impact on children's services? And if it is, what impact are you expecting?
Thank you. That is a very difficult question to answer at this stage, because obviously we're at the beginning of those reforms. So it's not something that I can answer today, but certainly going into 2026 we'll have a much clearer idea of whether there will be an impact or not, and what that might look like. But obviously we're already planning and referring to what the NHS have provided for us in terms of the ICB model blueprint, to ensure that we don't have any shortfalls and that we can mitigate those risks if there are any. Thank you.
Do we have any other questions? Yes, please.
I just wanted to ask a question about the deaths aged between 10 and 14. You said there were road traffic accidents and suicides. I just wondered if there's any kind of correlation between primary school, secondary school, what times these were happening, location. Do you kind of understand what I'm getting at? Kind of like, is there any education that can be done in school, like these road traffic accidents happening at a certain location after school, or, you know, children walking home?
I think it's a really good question, and it's something that we do consider in quite a great depth in our child death overview panels. So for children that die on the roads as a result of a road traffic collision, we have specialist road crime team officers that attend our child death overview panels to really give us that expertise and critical thinking around what could have been preventable in those circumstances. We look at every single circumstances on its own merit and to try and understand what could have been done differently. Now, education is a significant part of that. There is lots of different campaigns that are being promoted, not only through the partnership, through the Child Death Review panel, and also through policing colleagues across the road network around driver safety, road awareness. And then also, if there are any environmental issues, i.e. the location is determined to be particularly dangerous, was it on a bend, was it something where we've seen multiple accidents in that location, whether that's children or adults, that is something that we would escalate to the Community Safety Partnership. So to reassure you, at the Child Death Overview panel, we do have experts that come to that panel to provide us that real expertise around these particular issues. And then the Children's Safeguarding Board then promote educational awareness, inclusive of education colleagues who are key representatives at that meeting, to ensure that we get the reach with the messaging that we need. So dependent on the target audience or what the message is that we're trying to share, if it's in relation to young drivers, our education colleagues are really at the forefront of trying to ensure that that message lands where it needs to land, and it's tailored and delivered in a way that it will be received and understood by our young people.
What kind of numbers were we looking at? Was it incorporated in the 49 deaths for 24-25?
Yes.
Yes. Thank you.
Do you have any more questions? Okay, I'd like to ask a question. Going back to the Casey report, I did a little research and came across a report from Bernardo's Fostering Hope 2024. In there, it states that 7,290 unaccompanied asylum-seeking children came into the country up to June 2024. I've also done a further, so I know that some of those are included in the 1,300 that we have in care. My question is, where are they being placed given their culture and sexual exploitation? I just wondered if you could answer that for me.
So, the Bernardo's Fostering Hope report is a national figure at the end of March 2023. Majority of those children are over the age of 16, 84%, and a male around 96%. Currently, most live in supported accommodation settings, so they are settings that are in the community where the accommodation is funded through the Home Office, and they have support from workers who will help them access training, employment, education, depending on where they're up to. Only 16%, according to recent data in 2023, were living independently, and 38% of these children are in foster care. And the funds for those children who turn 18 is as per the national legislation and the national grants that you will be aware of, and I don't want to get into the detail of. Locally, as part of our population, we have somewhere in the region of between 56 and 60 children. It's a little bit of a movable feast of children who are unaccompanied asylum-seeking children. The majority of those children are males.
It does also say that they're aged between 10 and 17. So, and like the boys, essentially, I mean, you know, if they are that young, are they being put into residential care homes? And
I mean, the national figure, I have no idea where those children are or what they're doing, because it is nothing to do with me, but I can give you a breakdown of every single unaccompanied asylum seeker in Staffordshire. Not right now, but we know where all of our children are living. Most of our, any 10-year-olds that we've got who came into the country without a parent or a guardian would generally be looked after in a fostering arrangement. In Staffordshire, the children that we look after who are unaccompanied asylum seekers are older than that, 16 plus the majority of them, and any younger children are normally, that come in through an asylum route, will be living with their families, but we have a very small number of families in the county who are asylum-seeking families. We have had higher numbers over the years, but most of those have moved away to other parts of the country. But we have a number of various asylum-seeking populations. So we might have we've got Ukrainian families who are on a visa route, a temporary visa route. We've got Afghan families who've been repatriated as a result of the support that they provided generally to the British Army. And we had a meeting with the leader, Councillor Screen, and the deputy leader and the Councillor Large this week to talk, because we have a resettlement team that deal with unaccompanied asylum seeking, who deal with asylum seeking families, and we have an unaccompanied asylum seeking children's team that deal with and support those children who are living within Staffordshire. And we also have a larger number of children who have left our care, so 18 plus, who are also supported until they're 25, because under the legislation that if they have 13 weeks of care looked after by the local authority, then they're entitled to a care leavers offer until the age of 25.
thank you very much. Thank you. Councillor Wallens.
Thank you, Chair. How much of our budget goes towards paying for these asylum seekers with the leisure activities and so forth?
So with the greatest of respect, we're here to have a scrutiny item on the annual report for safeguarding, and I think we're getting into territory now which is about other specific practice areas, and I don't have the detail to. I've got all of that information, but I spent an hour and a half with the leader, the deputy leader, Councillor Screen and Councillor Large, discussing those very issues the other day, and I don't think it's relevant to unpack those in a scrutiny meeting, which is about safeguarding children, because it's a matter for the wider operational services. So I hope that is received as a respectful answer. I'm not declining to answer it, but I'm declining to answer it right here, right now.
Thank you. We'll move on. Does anybody else have any further questioning? Yes, Councillor Edward.
With the children deaths, obviously smoking can cause harm if their parents are smoking, but also for themselves. And with young people now being really attracted to vaping, what are places like Warrington doing to sort of prevent them from smoking or trying to help them stop it or sort of things like that?
I have no idea. But again, that's another one for the governor. So if that's okay, I have got an overarching responsibility, but in terms of that micro detail of what individual organisations or bodies are doing when young people are living in their care, we've got an expectation of how we promote material through our colleagues in public health, and the Director of Public Health, I'm sure, will be very happy to answer questions on vaping, because I think it's a high risk matter for public health for children and young people in the country. But in terms of what they're doing in Warrington, I have no idea. Sorry.
Councillor Luca.
Hey, Bernie. Just one for yourself. The children that obviously that we're looking after at the moment, when it comes to their education, what percentage of that are we having to send outside of the area, and what is, if any, plans we have to bring them back to area?
So we can, again, if I can respond to that question after scrutiny, because there is a breakdown of where children are living in, for those two, we've got a whole load of children who are in care in Staffordshire, we've got a smaller number who are in residential provision, and we've got a smaller number who are in residential educational provision. We've also got children who access independent education who aren't in our care. So there is a scrutiny item on kind of education as a global issue that is on the forward plan, I think, for this year. If we can deal with the questions around children in care and their educational settings, we have a virtual school. That sounds, there are real people that work in that virtual school. So the head teacher is not virtual, she is a real person. And they are responsible for delivering education for children who are looked after, some of whom are looked after, are educated in our schools. Some might be in an independent settings, some might be in alternative provision. But there is an annual report of the virtual head which breaks down both academic outcomes and some of the challenges in accessing education for some of those children that we can. I'll check with Helen after this meeting when it's on the agenda and make sure that we cover the virtual school. I'm sure it was in the brief, if that's acceptable. Helen, can we just check after the meeting that the education item includes the virtual school? I think it did, but my memory is
Yes, so I've just had a quick
rubbish.
look at the work programme now, and I'll make sure that as part of that we build that in.
Thank you.
I'm just conscious of time, so if everybody agrees, we'll make this the last question. Is that okay with everyone?
Okay. Obviously, I am aware from going over and visiting the staff that you are doing an amazing job over in the other building. But one thing I am concerned about is the caseload that the officers are getting put upon them, and the fact that they actually are, when they're speaking to people about education, they are being quite abused. So do we have any plans to put in place where we can accept a zero tolerance to protect our staff?
Well, I think that's a very interesting question and an important question. I think, you know, parents, families, we're all emotional about our children. It's an area that raises people's anxieties. Sometimes people deal with that calmly, sometimes people are rude, and sometimes they're aggressive, and sometimes people make threats. I think even, you know, from myself, senior officers and members of our staff have probably all been on the receiving end of people who are you know, we've got to acknowledge, very distressed, and sometimes they don't deal with that as well as they ought to. And I think they get, we'd like to think that we give people feedback on their behaviour. We do sometimes engage with the police to support us, and we do write to people with cease and desist notices who send sometimes 100 emails a day to many of us about key issues. So I think that we are committed to supporting our staff, to access support. I think in relation to caseloads, I share your concern. The demand in the system across both children's social care and special educational needs is exponential and showing no signs of ceasing, and it is a real concern for us and a real one of the reasons that we're looking to restructure and remodel the service, and also to invest in early intervention and prevention services going forward. So one, we can better support families sooner, but that requires finances, and it requires additional staff and investment and a remodel of some of the way that we do business at the moment. And I think that there's been an acknowledgement politically that the leadership want to support that, and we're grateful for that, because I think you visited one of the offices this week, didn't you, or last week? And I think when you talk to staff, that is something that I was in the offices yesterday, that people are worried about, and they know that we're listening, but it's hard to get a solution fast enough to some of those issues. But it is absolutely, I think, both on the political radar on Councillor Lakin, Councillor Screen and Councillor Higgins, Councillor Hunt's agenda, and we're looking at what we might be able to put in place urgently.
Thank you very much, everybody. And before I close, I'd just like to thank the panel for coming along today, giving a really good presentation and answering our questions. Thank you very much.
Thanks, Chair. Can I just say, if people have got any queries or questions, or like Councillor Luca, want to visit any of the offices, just because a lot of our offices are secure settings, a lot of our offices have families visiting them, if you can contact me and make those requests, then we can allocate them and make sure that you're supported and that you get a good visit at a time that's suitable to some of our staff who are in and out doing visits, etc. I think you had a good experience, didn't you? So,
thank you. Right, so if we could move on to our work programme.
Thank you, Chair. So there's been quite a bit of work done since the last meeting. You've got a family hub briefing that will be a Teams briefing. It was due to take place next week. We've actually put it back to the 4th of November because there were some officer experts that we needed to add to it, and there was a clash in their diaries, and I think it would be better to do it once and do it well with everybody there that you need, rather than leaving us with information that we need extra to what we're able to deliver during the briefing. And that briefing, if you remember, also included an invitation to the health scrutiny members, so that but it'll be a team briefing, and it's very much about giving the information that you requested to understand how the family hub system works. So that is now on the 4th of November. As mentioned earlier today, we have got a visit to the Children's Integrated Front Door and also the Adult MASH. That's on the 7th of November. I'll give you more details nearer the time. At the moment, we've blocked out a full morning, and that timing, my expectation is that will include, travelling from Stafford. You don't have to come to Stafford and travel on. I'm just thinking you would normally get here around 9:30. So how long will it take us to get there and accessing, and then we'll organise nearer the time. I'll be able to give you more information. Hi, Ben, did you?
Just while you're talking about visiting Linden, I was made aware yesterday when I was up there, there's major building work going on, so parking will be extremely limited. So if you can car share, that would be very sensible, because it is free parking, but there are an awful lot of police officers, social care and staff that work there. So if you went in 3 cars rather than 10 cars, that
that would be beneficial. Yeah, thank you. So maybe we do then, unless people have problems. I mean, I'm aware that we are quite diverse from the different areas of the county. Councillor Nixon, you won't want to drive all the way into Stafford to go back on yourself to just outside Stone, will you, for example? But if people are coming in through Stafford, then we can meet here and try and work away. Yeah. There is somewhere else that you can park and walk in. It's not as convenient. Mrs. Adula, you've been there, haven't you? And the parking is difficult because people flow in and out. That's the nature of the building. But nearer the time, we'll just confirm with you the actual logistics of getting there, getting in. You can't just go in the building. We'll need to meet and access it together. We need to be let into the building. But that's very much, we're organising it so that you look at the adult MASH, which is located there, at the same time as you understand the new Children's Integrated Front Door. So those two together. So that's the 7th of November, and I'll give you more detail as we sort of iron it out with the officers, how that's going to work. At the last meeting, you asked for some detail about DBS checks, which I've sent to you, and also some guidance on elected member visits that'll just help, hopefully, make sure you get the best out of any visit that you undertake if you're doing that, whether that's separate as independently as a council or through the committee. You also asked for some information on the DOLS forms, which you should also have received. That was sent out. Members were keen on doing something around education alternative provision. Now, we've got a couple of items already on the work programme around that, and some work around SEND. Again, that's already on the work programme, so we might be better seeing those and then deciding if you've got further work outside of that to do. Now, another area that you raised as an area of potential further work was around elective home education. And I've sent everybody a copy of the last report, which was 2018. And you raised it with me, and we said, well, let's just look and see if there's anything extra we can do. Because if we're finding the same information, there's no point in doing the same piece of work again. Having spoken to officers that are in charge of elective home education, the rise in numbers is so enormous that they would welcome you taking a look at that. So I don't know how you want to do that. If you want to set up a small working group to look at that, that's one way. That's certainly the way it was done before. I would expect a working group to be no less than 3 and no more than 5 members, and that will be extra meetings to what we're doing here. So it's some thought from yourselves. I don't know whether that's the way you would want to go, Chair, or...
Yeah, that would be good, but I have raised it before that the report is 7 years old, so it would be useful even if we had a smaller, not necessarily a full report, but something that we can, with numbers.
Sorry, Chair. So
like
is that
a briefing? Like a briefing of the, but more up to date.
So you don't want to do a working group. You would rather to have.
I would say go with a working group.
The working group. Okay.
I don't know.
Sorry, Councillor. Pop your mic on, otherwise it doesn't pick it up on the record.
I would say I'll recommend that we go with a working group.
Is everybody else happy with the working group? Yeah.
Okay. In which case, Chair, do members want to go in and think and let me know if they want to be a member, or would you like to look at membership? I'm conscious that we're missing 1 or 2 members, aren't we? So if I explain what it is so that people aren't in the dark about what they'd be signing up to, if we do a working group, any members of this committee could join it, as I say, no less than 3 normally, no more than 5 ideally, because it gets quite unwieldy. Once we get past that, you might as well be doing a full committee piece of work. And what normally happens for a working group is we meet together and we look at what the terms of reference are going to be. So what is it you want to get out of this piece of work? We agree the terms of reference. We agree maybe 3 or 4 extra meetings, depending who you want to see and what information you want, and I will organise those for you, and then we come together again and meet again at the end to write a report and findings. That report and findings are then brought back to the parent committee, which is yourself. So it's quite a lot to take on. Would members be more comfortable going away, giving it some thought and emailing me by the end of next week, maybe, if they want to take part? Yeah, okay, so after this meeting then, I'll whiz an email around so that everybody who isn't here is aware of it as well, and then if you can let me know. My only slight reservation is if, you know, I get 10 volunteers instead of 5. I shall be going to the chair and saying, who do you want? No, we normally do, in fairness, we normally do, because it is, occasionally we have that situation, we normally do on a first come, first served. So in other words, whoever, the first 5, if I get 10 people who are interested, the first 5 that volunteered, we normally take those 5, if everyone's happy with that.
Tonya?
Can I just say that I probably won't, because I'm on so many work groups and so many committees and external as well, that the whole week is always booked for me. So I unfortunately, I'd love to, but I won't be able to join the work group. Is that okay?
That's fine, no problem.
Thank you, that's a really good point, because it is this is extra to what you're already doing. So it is very, and I know that people have work commitments that are a bit of a nightmare, and I know that they have childcare and all sorts of things, and it's absolutely incredibly important that you take these into account before volunteering, because whatever is found out will come back to the main committee. So it's not as if you're never going to know what happened. The work is done in a small group and then it's brought back, so everybody will have the opportunity to see the information that was found out and to comment on it. So, right, so conscious of the time, because we've done well this morning, but also along with that, we've mentioned it already. I've spoken to Phil Pusey. He's more than happy to meet with everybody. We just need to get a time, so it's finding a time. And again, going back to what the councillor said, everybody is so busy trying to find a gap in everybody's diaries, but I'll do it as soon as I can, and I'll make sure following this morning that we also include Lynn in that invitation. Are you heading off? Yeah.
If I'm due to work commitments, I do need to know a little bit ahead of time, so if it could be like a month in advance or 3-4 weeks in advance when the date of that is, just so that I can just so that I can book it off, and because obviously I'm getting childcare and everything else.
Thank you. That's really worth knowing. So I'll make sure that we're having at least a month's notice. That's absolutely fine. And then just a note really that at the pre-preview we agreed, didn't we, to move the SEND report that was due. We were due to have 2 reports to this meeting, and because of the nature of the annual report, because it's such a good overarching view of safeguarding across the whole of Staffordshire, you requested that we put that back. So we did put it back, and that is on the work programme now, and so will be addressed. So it hasn't gone away, it's just been moved slightly back so that you could concentrate on this. Okay, I think that's that. Busy time.
Thank you, everybody. Does anybody have any comments or anything to add before we close? I think we're all done then. Thank you.